morning, everyone. As you can see in my background, this is Breast Cancer Awareness Month. And although we've done a topic on breast cancer awareness here at CEA, we're going to go back into another part of breast cancer that many may not know about it, and that is inflammatory breast cancer. So what is inflammatory breast cancer? So inflammatory breast cancer is considered a locally advanced cancer, meaning it has spread from its point of origin to nearby tissue and possibly to nearby lymph node. Inflammatory breast cancer can easily be confused with breast cancer infection, which is much more common. I think it's may have skipped the PowerPoint. My apologies. Yes, I'm sorry. So let's start over. So what is inflammatory breast cancer? Inflammatory breast cancer is considered a locally advanced cancer, meaning it has spread from its point of origin to nearby tissue and possibly to nearby lymph nodes. Inflammatory breast cancer can easily be confused with a breast infection, which is much more common cause of breast redness and swelling. So this is what inflammatory breast cancer look like. These are the photos that I had at the bottom right here. And here are some more pictures. And I'm going to go further into the signs and symptoms. So what are the signs and symptoms of inflammatory breast cancer? Inflammatory breast cancer doesn't commonly form a lump, as occurs with other forms of breast cancer. Instead, signs and symptoms of inflammatory breast cancer include rapid change in the appearance of one breast over the course of several weeks, thickness, heaviness, or visible enlargement of one breast, discoloration giving the breast a red, purple, pink, or bruised appearance, unusual warmth to the affected breast, dimpling or ridges on the skin of the affected breast, similar to an orange peel, tenderness, pain, or aching, enlarged lymph nodes under the arm above the collarbone or below the collarbone, flattening or turning inward of the nipple. So what is the cause of that? It is not clear what causes inflammatory breast cancer. Doctors know that inflammatory breast cancer begins when a breast cell develops changes in its DNA. Most often, the cell is located in one of the tubes, the ducts that carry breast milk to the nipple. But cancer can also begin with a cell in the glandular tissue, the lobules, where breast milk is produced. So what are the risk factors of inflammatory breast cancer? Factors that increase the risk of inflammatory breast cancer include being a woman. Women are more likely to be diagnosed with inflammatory breast cancer than men, but men can develop inflammatory breast cancer too. Being younger. Inflammatory breast cancer is more frequently diagnosed in people in their 40s and 50s. Being African American. African American women have a higher risk of inflammatory breast cancer than do white women. Being obese. People who are obese have a greater risk of inflammatory breast cancer compared with those of normal weight. So diagnosing inflammatory breast cancer. Tests and procedures used to diagnose inflammatory breast cancer includes a physical exam. Your doctor examines your breast to look for redness and other signs of inflammatory breast cancer. Imaging test, as well as removing a sample of tissue for testing, which is called a biopsy procedure. So what are the treatments? Inflammatory breast cancer treatment begins with chemotherapy. If the cancer hasn't spread to other areas of the body, treatment continues with surgery and radiation therapy. If the cancer has spread to other areas of the body, your doctor may recommend other drug treatments in addition to chemotherapy to slow the growth of the cancer. Chemotherapy is used prior to surgery for inflammatory breast cancer. This pre-surgical treatment, referred to as neoadjuvant therapy, aims to shrink the cancer before the operation and increase the chance that surgery will be successful. Surgery. So after chemotherapy, you may have an operation to remove the affected breast and some of the nearby lymph nodes as well. There's also radiation therapy, targeted therapy, hormone therapy, and immunotherapy. So what are some questions you should ask your doctor if you suspect that that's what you have? Ask your healthcare provider about what your cancer diagnosis means for your treatment options and likely outcomes. Questions you can ask are, what stage is it? Which specialists will be involved in my care? What treatment options would you recommend? What outcomes should I expect from treatment? And what are potential side effects or complications that are related to treatment? And can you connect me to resources? Because there's always support groups available. for patients. And these are questions you can ask in general with any diagnosis. It doesn't have to be cancer. You can ask the stage or how far or how advanced your disease or the diagnosis is that the doctor have presented you with. Please note, inflammatory breast cancer usually develops quickly and spreads to other tissues outside your breast. It often reoccurs after treatment. Early diagnosis and treatment are vital to managing the condition as effectively as possible. Because inflammatory breast cancer spreads quickly and is found later than other cancers, the outlook for people with this condition is generally not as good as for different types of breast cancer. Still, some live many years after IBC diagnosis. Inflammatory breast cancer is a rare type of cancer, and again, it spreads quickly. Schedule an appointment for your healthcare provider immediately if you notice changes in your breast, especially a change in one breast but not the other. The changes may be a sign of a less serious condition, like an infection. Still, inflammatory breast cancer spreads fast. Again, as I stated, if your symptoms are a sign of inflammatory breast cancer, you'll want to begin treatment as early as possible. Don't delay seeking care that can potentially improve your prognosis. I want to give special acknowledgement to the MD Anderson, Sloan Kettering, Mayo Clinic, and Cleveland Clinic for the information that I provided you today. I hope this was helpful. And should you have any questions, please join me in Zoom. I'll be happy to answer those questions for you. God bless. Stay safe. Remember, get your mammograms, your yearly checks. It's very important. Enjoy the rest of the service.